I am Sherry Cruz. A large majority of individuals aged 17 and under who are in conflict with the juvenile justice system come from marginalized groups and communities with little access to resource equity and limited ability for capacity building. I have to be a social worker to facilitate macro, meso, and micro policy and health and legal education while advocating for social service resource availability and health as a human right for this juvenile population. The juvenile justice system affects individuals who are poverty stricken and individuals of color. I have to be a social worker to dismantle the barriers to human dignity and equality by addressing the social issues of oppression and the social injustices of racial and economic inequities currently plaguing our legal system and our society. Multiracial and gay and lesbian juveniles present at greater risk are key new research findings for me. I have to be a social worker to use evidence-based strategies and professional use of self to empower juvenile offenders in their quest for legal, political, and social justice. I have to be a social worker to minimize risk factors among juvenile offenders while identifying and implementing political and social services that are necessary to maintain human dignity, health as a human right, and incarcerated quality of life. As stated by the International Federation of Social Workers, the number of juveniles going through the formal legal system should be identified and reduced by diversion or interception. Measures to integrate the juvenile offender with the rest of society should be strengthened. I have to be a social worker to have a broader political impact by helping to reform a legal system that is hostile to marginalized populations. I have to be a social worker to relationally connect juveniles and their communities for reintegration into productive citizenship through empowered strength-based practice, early intervention strategies, political and legal social action, and the dismantling of barriers of oppression to health as a human right and human dignity. My passion for social justice empowers and enhances my professional practice with every juvenile client, as all people have an equal right to enjoy the basic conditions which underpin human health.